Hello. Good morning. Today I'm going to have lecture on a topic that is medical emergencies in dental office. Yes, the medical emergency in dental office. Basically, here today we're going to discuss what are the different medical emergencies that we face in dental office in day-to-day life. Okay, so basically, the topic contains prevention, medical history, preparation, unconsciousness, airway obstruction, hypertension, allergic disorders, acute renal deficiency. These are the different contents and various adverse drug reactions. So basically, the life-threatening emergencies can and do occur in our practice of dentistry, and they can happen to anyone, a patient, a doctor, a member of the office staff, or person who is merely accompanying the patient. Although the occurrence of a life-threatening emergency in dental office is very infrequent, but then too, there are a number of factors that exist today that can increase the likelihood of happening of such incidents. So therefore, we should must be prepared and be ready to face such circumstances and be good enough to deal with such circumstances. Majorly, the factors that include are increasing number of older patients who are seeking dental treatments, the therapeutic advances in the medical professions, and the growing trend towards the longer dental appointments, and also the increasing use and administrations of drugs in dentistry. Now, whenever a true emergency happens in an office or in your home, the first few minutes can mean the difference between the life and the death. So we must be very much prepared, be good enough to handle such situation. Not only each staff member, not just the dentist, also the other staff members which are there should initially first fill out the proper medical history of the patient, take the proper medical history form of each staff member. Okay. Moreover, they should also be trained in basic life support such as CPR, mouth to mouth resuscitation as a Hamlich maneuver. So the staff that you recruit, dental clinic should also be trained and good enough to handle such emergencies. They should be able to be trained and be able to give basic life supports such as CPR or to mouth resuscitation. Moving forward, for the basic principles of medical emergency management includes the prevention, the preparation, and the management. Now, prevention, first of all. So, as per according to McCarthy, he said a complete system of physical evaluation for all the prospective dental patients can prevent approximately 90% of a life-threatening situation. And as per Goldberg, he also said, whenever you prepare for emergencies ceases to exist. So basically, if you are prepared for emergencies, then whenever such situation arises, you should be trained enough to handle such emergencies. So this, so as we all say, prevention is better than cure. So the prevention is by taking the proper physical evaluation of the patient that we are going to treat. Prevention is the most important phase of treating a medical emergencies, and it also must be remembered, however, that despite all efforts at prevention emergencies will still cease to occur and will definitely happen. Now, there are three steps of prevention of medical emergencies in the dental office. Now, basically, first and the foremost step that we need to take is the medical history of the patient. So, what are the questions that we are going to ask while we are going to take the medical history of the patient? So, questions such as or signs that we have to look while taking medical history are there any recent changes to the health of the patient? Okay. Followed by, is the patient under the care of any physician? Okay. Then, has the patient had any serious illness or has gone through any kind of operation recently or even in the past? Does the patient have any allergy to certain drugs, to certain things? That should also be taken into consideration. Is the patient taking any kind of drugs or medications? That should also be considered. Remember to ask about over-the-counter medications as well. Is the patient pregnant if she is living? So these are the questions that you have to ask or take into consideration while taking the medical history of the patient. For already diagnosed disorder, you must ask questions such as, when did the patient develop the disease or the particular problem? How is the problem controlled? Is there anything that makes the problem worse? Has the patient been hospitalized for the particular problem or disease? Are there any restrictions on the patient or any restriction of diet or anything? So in the patient who has already been diagnosed with such disorder or a disease, you have to ask such question while taking the medical history of that particular patient. Then we come to the evaluation goals. Okay. So basically, evaluation goals includes the physical evaluation and the psychological examination. Now, physical evaluation includes the medical history questionnaire, that what are the different questions that we need to ask to the patient. Then physical examination includes the different vital signs as well as the visual inspection where that you see when the patient comes to you, different functional tests as well as the oscillation of your heart and the lungs. Then dialogue history, recognition of the dialogue history will let you know the recognition of the anxiety. Then we come to the physical examination. Basically, physical examination includes the psychological examination, sorry. That includes is the medical history questionnaire again, then anxiety questionnaire. You have to ask the anxiety questionnaire, then observation of the if there is any increased blood pressure or heart rate, as well as is there any uh, trembling or excessive sweating. All this happens when the patient is and patient is in anxiety, as well as dilated pupils. So these are the things that we need to take into consideration at the time of psychological examination of the patient. After that, moving forward, you have to is what you have to do is to formulate your treatment uh, plan at this stage, such as first thing is to determine how this treatment plan relates to and affects or is affected by the finding of the medical history and the evaluation. Obtain the medical consultants if needed at this point. If you feel the need of, you need a medical consultation or physician's advice and consultant, then it should be considered at this point, depending upon the history that patient has given, or the disorder the patient is facing, or the drugs he is taking or she is taking. You have to obtain the consultation of that particular physician. Now, reasons to obtain the medical consent include: doubt exists as per the patient's conditions, history of dangerous or suspicious signs or symptoms, history of uncontrolled illness or multiple medication, and ASA class 3 or higher signs. ASA class 3 physical systematic signs which are there in the patient note. So all this tend to be the reason where we need to take the consultation of a physician. So moving forward. Now, there has been a physical status classification system which was given by the American Society of Anesthesiologists in 1962. So basically, they classified depending on the patient systematic situation. So ASA1 says a patient who have who is without any kind of systematic disease and and a very normal healthy patient. And then ASA2 is basically a patient with a mild systematic disease. Then we come to ASA3, is a patient with a severe systematic disease that limits the activity but is not incapacitating. Okay. Then we come to ASA4, a patient with incapacitating systematic disease that is a constant threat to the life of the patient. ASA5 is a morbid patient not expected to survive more than 24 hours without surgery. Then ASA6 is clinically dead patient being maintained for harvesting the organs, and in case of donation of the organs. And ASE, that is basically emergency operation of any variety. E precedes the number indicating the patient physical status. So this is how classification has been given depending upon the particularity of a patient systematic disease. Moving forward, classification of life-threatening situations. Classification of life-threatening situation. Basically, there are different classification given for that. But first we see the classification that is systems-oriented classification, in which it is classified into infectious disease, one, then immune system allergies, skin and appendages, eyes, ear, nose, throat, respiratory tract, blood, GIT, and liver. Then other classification is based on the cardiac etiology, which can be classified into: first is non-cardiovascular emergencies, and the other is cardiovascular emergencies. The non-cardiovascular emergencies include first A, that is stress related. In stress related, they are further subdivided into vasodepressor syncope, hyperventilation syndrome, acute adrenal insufficiency, asthma, hypoglycemic reactions, epilepsy, thyroid crisis, and B is non-stress related, such as orthostatic hypotension, overdose reaction, hyperglycemia, allergy, So these are all the non-cardiovascular emergencies. Then we come to the cardiovascular emergencies, which are a stress related, such as angina pectoris, acute myocardial infarction, heart failure, cerebral ischemia and infarction. Then B, which is non-stress related, is the acute myocardial infarction. Now, the other classification is basically classification that is based on the clinical signs and symptoms. Now, the first, that is unconsciousness. Now, in unconsciousness, there is vasodepressive syncope. Basically, in this, there is a certain drop in the heart rate and the blood pressure of the patient, leading to the unconsciousness of that particular patient. Then there is orthostatic hypotension. So basically, in this, there is low blood pressure that happens at the time of standing from a sitting position or a sleeping position. Then we come to the acute adrenal insufficiency. Basically, it is caused by sudden uh, deficient production of adrenal steroids. Then we come to the B, that is respiratory difficulty. That is difficulty when there is airway obstruction, hyperventilation. When the hyperventilation, patient starts to breathe very quickly, asthma, then heart failure or acute pulmonary edema. Then C, that is altered consciousness, that can happen due to hyperglycemia or and hypoglycemia, hyperthyroidism or hypothyroidism, cerebrovascular accidents, seizure disorders, drugs related to emergency situations such as drug overdose reaction, allergy, chest pain such as angina pectoris or acute myocardial infarction, and lastly, that is the cardiac arrest. So this classification is based on the clinical signs and symptoms of the patient. Then prevention is been done. Prevention basically included the medical history of that particular patient, then followed by physical examination, psychological examination, seeing all the vital signs and symptoms of the patient. So depending upon that, at the time of medical history itself, we can see and act accordingly. Then we come to the preparation part. More patient will do well when you act than when you don't act. This is a saying. Then in the preparation part, what should be included is staff training should include the basic life support training for all the members of the dental office staff. Then training in the recognition and the management of a specific emergency situations. Moreover, there should be emergencies fire drills so that the staff can be trained. Then we come to the office preparation should include the posting emergency assistant numbers, then stocking emergency drugs and the equipments for it. What is adequate preparation? That's a question that how we get to know that the preparation is being adequate enough. So the guidelines may vary by the state or by the organization, but in general, it is expected that the doctor will be able to initiate the emergency management and be capable of sustaining a victim's life through the application of the basic life support or BLS. Now, this is the basic flow chart of a basic life support. Now, in this flow chart, you can see D, that is stands for danger. First of all, we need to see is check for the danger. Okay. Then comes R, which is stands for responsive. If the patient is responsive or not, that means if patient is conscious or unconscious. If the patient is not conscious, then try to call 100 or helpline number as soon as once you find out that the patient is unconscious. Then A, that stands for airway. That means you need to open the airway and look for signs of life. Need to give complete airway to the patient. Open the, if there is any obstruction, you should open that up. Then comes the B, that is give two initial breath if not breathing normally. If the patient not breathing normally, you have to give two initial breaths. Then C, that is compression. You have to give 30 chest compression, almost 2 compression per second, followed by 2 breaths that you have to follow in a basic life support. Then we come to D, that is attach AED, that is the automated external defibrillator, as soon as possible, as soon as it's available, and follow its prompts. Continue the CPR until the qualified personnel arrive or signs of life return. As until the qualified personnel or ambulance arrives, you need to continue giving CPR or till the signs of life returns. No signs of life is, what are no signs of life is basically unconsciousness, unresponsive patient, not breathing normally, and not moving. These are no signs of life. So you have to wait. You have to keep giving CPR till patient attains consciousness or become a bit responsive, or till the qualified personnel arrive. So this is how a basic life support should be followed, should be done, and this is how you can handle or manage the emergency till the qualified personnel arrives. Now, basic principle of managing all the medical emergencies is first is the basic life support, then is place the patient in the supine position so that blood flow can be directed towards the upper body. Call for the assistance as soon as possible. Assure the patient if patient gains consciousness. Maintain the proper airway for the patient, so the place should not be that much crowded. Clothes should be loosened up. Place the patient on oxygen as indicated by the nature of the emergencies. Also monitor the vital signs such as heart rate, BP, pulse rate. Diagnose the nature of the event and initiate the specific treatment. Stress reduction protocol for the anxious patient. Anxious patient is, first of all, you should recognize the patient's anxiety level. Then consider using pre-medication or sedation. In such patient, you should schedule the morning appointments as well as minimize the waiting time and the watch of appointment length. So make sure to use adequate pain control. Also monitor the vital signs, and medical consult if required is needed. When you feel that medical consultation is needed, then you have to take the medical consultation, as well as you need to try to schedule morning appointments and use proper drug for pain control so that pain doesn't lead to the anxiety of the patient, and has to give pre-medication to the patient before he or she arrives to the clinic in order to calm the patient's anxiety. Now, emergency drugs and equipments. So we have come to the prevention, preparation. Then now is the emergency drugs and equipments that we should have in our dental clinic. Now, basically, it can be classified into two items in emergency kit include oxygen, epinephrine, diphenhydramine, dexamethasone, aromatic spirits of ammonia, ampoules, albuterol inhaler, then nitroglycerin. whereas the other critical emergency equipments include the O2 oxygen delivery system, syringes, suction tips, tourniquets, and McGill incubation forceps. Now, administration routes for drugs by rate of onset is endotracheal whenever available, and the drug such as epinephrine, lidocaine, atropine, and naloxone can be administered. Then other intravenous. Third is sublingual or intralingual, and fourth is intramuscular. Now this is how, as you can see in the image, is a basic kit, and which is further divided into 4 modules. Now, module 1 is the basic emergency kit, which uh, consists of the critical drugs and the equipment. Module 2 contains the non-critical drugs and the equipments. Module 3 has advanced cardiac life support, and module 4 has antidotal drugs. So, and in each module, there are both kind of drugs, injectable as well as the non-injectable drugs are there in each module. I will discuss see each module. Now, as we know, in each module there are injectable and non-injectable drugs. So in module 1, injectable drugs are the epinephrine, the doses of 1 to raised to 1000. Then second is antihistamine, that is ideal doses 10 mg per ml. Then we come to the non-injectable drugs, which are the oxygen cylinder, then vasodilator, bronchodilator, anti-hypoglycemic such as orange juice, aspirin, which can be given 160 to 324 mg orally. Then emergency equipments are the oxygen delivery system, which you will see further image, suction and suction tips, tourniquets, syringes, and McGill intubation forceps. Now, a little brief about each drug. Now, first is the injectable drugs, that is epinephrine. So basically, epinephrine is valuable in the management of the respiratory and cardiovascular manifestation of allergic reactions. So its properties are basically it has a very rapid onset. It has bronchial smooth muscle dilator. It acts as a bronchial smooth muscle dilator. It also has histamine blocking properties, and whereas it has a vasopressor action. Now, availability should be available in preloaded syringes of 0.3 milligram in initial phase of anaphylaxis, and in panic stage of anaphylaxis, a larger dose is recommended. Now, clinical morphology of epinephrine is pharmacological action is basically adrenergic stimulation of both the alpha and beta receptor sites. Clinical indication when it is indicated is mostly at the time of cardiac arrest or a life-threatening hypotension. In case of life-threatening bronchoconstriction, also in cases of anaphylaxis, in case of heart failure, in case of cardiopulmonary resuscitation, as well as acute allergic reactions such as edema of larynx. The dosage is around 0.1 to 0.5 mg depending upon the route of administration as well as depending upon the emergency status. Whereas in a pediatric patient, it is 0.5 mg per kg per day intravenous in 4 divided doses. Maximum dose can be given is 300 milligram. Its onset is very rapid. Then we come to the clinical pharmacology of diphenhydramine. Its pharmacological action is antagonist to HI receptor sites. Its indication is basically at the time of allergic reaction such as urticaria, at the time of itching or edema. Its dosage is around 25 to 50 mg IV or intra. I am sure. Whereas in pediatric patient, it is around 0.5 mg per kg per day intravenous, which may be can be divided into 4 doses with the maximum of 300 milligrams. Its onset is also very rapid in action. Then we come to the non-injectable, that is oxygen is supplied in variety of sizes of compressed gas cylinders recommended, which is quite portable in emergency situation, such as e-cylinder that provides oxygen for approximately 30 minutes. Then nitroglycerin, which is used as a vasodilator dilators in the immediate management of chest pain, or which can occur at the time of angina pectoris or acute myocardial infarction. Then we come to the amyl nitrate, which is supplied in a yellow Vaporol or a gray cardboard with yellow printing in doses of 0.3 ml. Clinical pharmacology of oxygen is basically pharmacological action is increase the arterial oxygen content and concentration, increase the hemoglobin saturation. Clinical indication is emergency in which there is any respiratory distress to the patient, and its dosage is 100% during the emergency situation. Then we come to the clinical pharmacology of nitroglycerin. It's basically indicated at the time of chest pain. Action is rapid in 2 minutes. It reduces the cardiac work by the action on the peripheral vasoculture through increased blood supply. It's anti-angina action due to reduction of the workload of the heart muscle. Its dosage is around 0.4 mg sublingually. It can be given in 0.3 ml mild nitrate. Then we come to the pharmacological action of albuterol. Basically, it is a bronchodilator. Here, this is how it is available, as you can see in the image. Its action is basically bronchial smooth muscle properties. Indication, it is indicated in an acute asthmatic attack and alveolar reactions with bronchospasm. Dose is 1 to 2 inhalation, which can be given in the interval of 4 to 6 hours. Then we come to the anti-hypoglycemic. So basically, these are indicated in hypoglycemic states in the diabetic patients, and they are given orally if the patient is conscious, and parenteral if patient is unconscious. 50 ml of 50% dextrose is administered. Then we come to antiplatelet. These are basically antithrombotic drugs which are given in phase of myocardial infarction, and their dosage is around 160 to 394 milligram orally. Now these are the images of equipments, emergency equipment. This you can see is here, that is the oxygen delivery system. This one. Then these are the different suction tips that can be used. Then this is the McGill's forceps. This is the McGill's forceps, and these are tourniquets. Basically, they are used to restrict the blood flow. So these are the different emergency equipments that we use in emergency situations.